That shine shikedo shidne kodo kujahanata siyo gizdo the modo na kijona hune kodo hane linin hich nani ne do the kosin sanas it's at the petitini ajabahan ne kodon hich ne ko alta it's what is in lini shin be a deal ni shady ma ideshkish nin shlan to the tree ni bashin kabahan da shichegot ash edashanale kodas ahol yeda ade is shike kodoshin to deals and dole Kodemajan role, Shamana Hassan, Yadilhil. Zilistan, Twistan, Alcheti, Alchewan, Tradedin, Ani, Sa Anarabik Ahojan, Niyajane away ni Dron Condi, Binibi, Nahikal, Agui Jaikon, Tadilzen, Aro Yat Ehon, Nadi Kato, Nat of the Edi, no. Od on hit Todizan Lini, Nakadadihi dole, Hon has twin hizani. Adon hi tel ketanle arabel hay je adon hi ganhas agon hi nal gloshin da krego ya at nahido a chamana hasan lini go aro ya kon ala ani zeno kon da ist ado hata asgizi kon per kon lodo le iket adon lebesit aje ba na hol ya dole ha de shina nishte da kre da alt hata danle Aro kon amado je che inala dan le en sahi dan lini alton benelni dole aro kon hit lat so da dan le kon ya at kon ni hinago na khata halyan dole aro alanj el ne shi kon ni hit la dan lini isen de jahi kon den sesida aro kon nasgo net ni je kon trat nas in lebel nas ango CHR da beditne Éidir thompa díl sin dó le aníl chun atla aníitina ádó chaisíne lá gónacha altsinne ní dhearsin hi a bhfuil an líní i tranta iste an le bel chun ládó le chun nás go net nidir chun iad go chun ináda hol ádó le ináda hol ádó le ádó ala láide chun bada á taid an líní do chun benasní ó le an dúna gónacha altsinne hi dhearsin hi a bhfuil ná déintcin dó le chun Aro kon hi de nebel gehad zo beka kon de niel nishi dot dat deel nishin hinat ani dan lini aan le besh bahasa an etela de dan lini yat hon nada pedole ben hat ben an kin jono hon nada dit atole nije all il als hon at eland den be nada hil sodole nas go net nije Hot kodot so en lini ahon shehende kon ni de net an ango banana si or hi masanen hi cheda danle betrayata hot etole kon ben an kin lini kon nas de ni liet ole kon hi zado nas kon nana deltole hot so en lini ahon shehende kon be nana si ole atile ben hi hojanasli Thank you for tuning in. Donna Educator Shidne Ade Hanata so Gizi Kodoshe in Hinat An Lini Consultant Lini Hopanahuil Atole Honorable President Jonathan Ness.
Thank you, Dr. Fowler. Kodona Hatsudin Zenigi Hihe Anil Squashin Ade Kewit Inde Binda do Ashi Quiche Sudadil Zentla Jukun Yahilni Did Kosenskaginast Eitzata Bikije de Bagido Kun Ni Ken Hinne Azel Indan Lenigi Nakhandal Nishni Gedades Igi Bananish Inigi Kodo Banda Wheelne the Mona Atle on it na Kije in the Anishun Nesna or Kilo. So Kodo here than he didn't need all that had that so Gizdo then he Natigi do that is not Sagi. Aron here Zel Indo Con Nashni you get that there's Ingido Kodo Hanet Hijikunda Yil Ingi here. Nachad Bedini do the Navajo Department of Health Tsilide Linigi Dr. Jill Jim Jo Aja Alaja it's is Ba Hayaja it's is Bikidez Ija Ya Halyado Aja Banda Anish Del Yazi Edo A Kuja Dina Nigi Stoitini Yikidades Ido Nalsosika de Leti na antiendo hashit au ya nasnit nebiki apaka nigi je aje bananish del Navajo Epidemiology Department has age. Ada Washington has age. Kujin Hilaho Zoge, Navajo area. Kuje Captain Brian Johnson, Hanan Hiji Kunail, Kuje Washington, it's East Bahayaja Indian Health Service, Hanan Hiji Kunail. Ada Kudoda, Toge, Nika Natjaji, Abilagana do, Nashni, Del Khagi, John Hopkins. Center for American Indian Health has Anji Dr. Laura Hammett. Edo konon hije hanatse do hanet hije konayili. Aro kodo shad Dr. Perfilia Fowler Enana kodo daisunal tsagi di shahat esasata don dal nestalladi being del kidigi computer that egi iPad that egi ashitan hitzana is kuditsa hotzanj. Akonda di Dr. Hammett Nakhanal Nesto Ajitloja Bilagana John Hopkins Center for American Indian Health has Aj Nika Nacha Jadi Nash Nigi Ein Dishka. So Huta Ebenanish a daily Ido Huta Elka Nature Navajo Department of Health has Ajido Indian Health Service. John Hopkins do adentla le zel indaznela edo hot yan hinanish khadel enjo di asahan deitle na kijin da annashuna the mo na atle hon di han ngije kondeli aro the mo da initial di jin da annashuna ye do da initial do the more yajigun do the more gonna di yos kasona kuje chinlinja ha ho zoje ya fair bandi de ako the more yajigun shi Saturday go parade le do le so shi on his thousand do le corona not sauce ya hadelia ya di ahot ya jo lati lesti nashni binan tinigi kodoni hije kodalia do yidigolche de kreja tashik enoslin kachin ya la da hatna da wins ala ede sa chudayol ede ala ede sa kloya ya da kishin wins zinde jo aje da isanol tsa goshin ya do yego naslnegi da nada dol was la shud chikedosh na so ataso tiedo benda no tien ad bis keda hot energi do lego da trada do ka ni ze ni chi gedas ti o kontra do ka kon da hatne ha la shay na che ko dalle di massa da egi da hat no da ya dalti ni da kregi isi kon hen hilbeda hazn jadi bikje na ba de naslnegi so hot in da ni tien do biken si zingo ashon yasel kidne kon de nebike op ka di naslnegi so ata di nila da inoslne do biken so zin kon ga ni zel in dan denigin khalchen do di monkey pox da no da ba na han ha shi na nasna no ba yatke so do ze bikje na nishigi ein hije kul ya do le di jin da na shona so la na wing zne kat ni hije kul ya ze gi bikje na nishigi ein hije kul ya so shi di jin da na shona le zel in na kada halon do le la konde di monkey pox nigi ya do ya ni ke ni nebe do na da di ich haut so gibi so ich nicht so das sind be andeit so asho do kon hije ja ich ni da di monkey pox will yagi azze di azze kijna nishige in khallo do lesti Thursday gonna so ein on spelzen do les na khabi gashi na khana do da do tse in aslini ado di fair do parade band alte shkonda da hosnya ado lego ndakhalia le na njoje de do the parade is le da do heishi atla chide honna beso o do yo an hikain hinne ben dastel nichin da huitza ko da lia do ndakhala ko heda tla go do heda biga hada no that's labs hados na ashmosh kenaslin ot da huiliado elkida de tido de kenaslin di fair or parade mandas degi. I just wanted to quickly say in English, I know that Navajo Department of Health, Dr. Jim DelYazi, Ike Shess, Captain Johnson, John Hopkins Center for American Indian Health, Dr. Hammett, Dr. Fowler are here to share more information with you. I just got word that this week, Thursday, Friday, we will have the Monkey Pox vaccination. We sent a letter to the White House, to the Department of Health and Human Services, letting them know that we need to have the vaccines for the monkeypox as soon as possible. And within a couple of weeks, we got the answer from the federal government and from the White House. Just the same thing we did with the vaccine for COVID-19. We advocated heavily. We sent the letter and we got the vaccines the same day as everybody did throughout the United States. So that's good news that we're going to get the monkeypox. No confirmed cases here on the Navajo Nation of monkeypox thus far. Vaccines are going to be available. We just need to be safe. With the 3 days of reporting of COVID-19, this is COVID-19 now, 3-day period, 57 new cases. So for 3 days total, 57 new cases. That's, I think, one of the lowest weekend totals that we've had in some time. 1 death. Our thoughts and prayers go out to everybody who's been impacted by COVID-19. And if you go to the Navajo Department of Health website, you can see the communities that have a health advisory notice, 56 communities. And that's due to the reporting and the contact tracing that's slightly still here But what we want to just let you all know is to stay safe, to continue to stay safe. We have the Central Navajo Fair this weekend, starting Thursday, Friday, Saturday, Sunday. Parade on Saturday. What we're saying is just to follow the same protocols. I know people are tired of it. I mean, I've seen comments like, take the mask away, but the mask will stay because of what's being reported here on Navajo with the increase in cases, but now we're seeing it going down a bit. But the monkeypox is not here on the Navajo Nation, but we want to keep it out. The same protocols that we use for COVID pushes back on monkeypox. So we're going to continue to keep that provision in place. So wear your mask this weekend, please. The monkeypox vaccination is here again at our healthcare facility Thursday and Friday. If you want to get that vaccine, get it at the healthcare facilities. The COVID vaccine, the boosters, are also going to be brought to Navajo, ready for the fall and winter season. The flu season and the spread of the germs and all these viruses go high during the winter because we're inside. And so get your flu shot, get your boosters, and get your vaccines. And let's get ready for the winter. And also, I know there's been a lot of weather, rain and all. The past few days, we didn't have any rain as much. Now's the time to get prepared for the winter. It just seems like it's getting colder. So let me just say, I'm sure Grandma and Grandpa and Nullies, our elders, have said this: is you get prepared now for the winter and not at the last minute. And get the wood, get the fuel for your homes to be warm during the winter season. And so we appreciate everybody tuning in every Tuesday, and we're going to continue to do this. BA4, BA5 is out there, but what the folks that are going to give you an update on, we'll talk a little bit more about what's happening in and around the Navajo Nation. So with that, I'm going to turn the time over to let's go to Del Yazi. Del, are you there? Turn the time over to you, Navajo Department of Health, Epidemiology Center. All right, it looks like we don't have Del right now, or do we? Okay, there he goes. Go ahead, Del, take it away.
Okay, thank you, President. Hi, everyone. Thank you all for joining us. These are the latest numbers that we have for Navajo Nation COVID-19 for time period August 12th through the 18th. This is our recent cases and trends covering a 60-day time window here from June 20th all the way to August 18th. Again, as you may know, that our numbers do fluctuate every day. And however, you see this orange line, which is our 9-day, moving average. As you can see, this latest report, we did see a bit of a decrease in the number of cases for a 7-day time period, which is a good sign perhaps for us going forward. These are our core metrics for Navajo Nation. New cases per 100,000 people over a 7-day period is at 502 cases per 100,000 people. This is still a high number for us, but as I mentioned, we did see less cases this time around. Percent staff beds occupied by COVID patients is at 5.5%, which is that medium risk for us. And then Navajo Nation new COVID hospital admission rate. This remains the same from last week, 0.65 per 100,000 people. It's a biweekly update, so we'll update this next Monday with the new report, but we remain at medium risk from last week. I'll just mention that I look at the national hospital admission rate is at about 1.7. So we are certainly below that, so that's also a good thing. Supplemental metrics here. Navajo Nation new cases over a 7-day period. There were 795 new cases, which is a minus 27% change from last week. So we are certainly trending the right way with less cases this time around. 7-day lab-based positivity is 18%. It also went down from 25%. So that's also a good sign for us. Hospital capacity here for bed occupancy remains stable at 56% for regular hospital beds, and then 55% for ICU beds. So our threshold for this is 80%. So we are certainly below that. So that's a good sign. Vaccine coverage, Navajo Nation residents only here. About 69% have completed the primary series as of August 12th. And then 42 or 44% are now up to date. And then all the COVID strain surveillance is that's still ongoing. We have detected all of the Omicron variants and the sublineages on the nation to date. Vaccine numbers here as of August 12th, 128,856 Navajo Nation residents have completed the primary series. 82,676 are now up to date. Epi curves for the entire pandemic. The blue is the U.S. and Navajo Nation is orange. We are, with the latest numbers here, we are seeing a decrease. Again, that's all good signs. As I mentioned, we are seeing less cases, but there's still a lot of cases. From August 12th to August 18th, this is 7-day COVID incidence bar chart. For Navajo Nation here, we are in second at 501 cases per 100,000 people. And then you see the red bars here, the Four Corner states. New Mexico is still seeing some cases, even though they've gone down too. So again, good sign, as well as Arizona, Utah, and Colorado. As you can see the picture here, the only Four Corner state that's just dark shaded blue is New Mexico. So there we're still seeing some high number of cases in New Mexico. Community transmission across the U.S. really remains high with all the red color, high transmission, especially within our region. All the counties within Navajo Nation continue to be red. Our COVID strain surveillance on Navajo Nation, this was updated last Thursday, 465. A couple highlights here to make is the BA5 sublineage, went from 183 from the previous report to 388. So that did go up quite a bit. Then the other one we're still seeing some currently is the BA2.12.1. It went from 308 to 365. So those two Omicron sublineages are we're seeing here on the nation. This bar chart is sorry, I cut off the vertical axis here. These are the hospital, the facilities on Navajo Nation. This just shows that all facilities are really, participating in the COVID strain surveillance, which is a good thing because provides us a good representation of capturing, a Navajo Nation cases all over the nation. So then this bottom chart is, this first row up here is actually the BA5. As you can see, the darker colors here, meaning there are more cases being detected with the BA5 all the way up to July 30th. So that's just one of the main highlights here and for this latest report. Then for the US, the COVID variant profile here for us, according to CDC, again, the BA5 is the predominant variant across the US, making up about 89% of all the variants on within the US. And last, this is our high risk chapter list. This green one over here is the latest number of chapters making this list. There were 56 chapters. Then as you go across to the right here is going back all the way to this red column here is the going back 6 weeks, July 8th through July 21st. These 42 chapters have been on this list for at least 6 weeks. And this, the number of chapters have been decreasing as well that make this list. So it's also could be a good sign for us, but we'll continue to monitor going forward. So I'm going to stop here. That's my last slide. So I'm going to hand it over to Captain Johnson. Please take it away. Thank you.
Thank you, Dale. Really appreciate it and appreciate the work that you and your team continue to do. Again, this is Captain Brian Johnson with the Navajo Area Indian Health Service. I serve as the Deputy Area Director for the Navajo Area Indian Health Service, work in St. Michael's, Arizona at Navajo Area Office. And just wanted to make a few comments today concerning a little bit about COVID-19 and also monkeypox. We know that monkeypox continues to get a lot of national media, and so making sure that we're sharing the information that we have is certainly, we want to be transparent with the public. And for COVID-19, just wanted to reassure the listeners out there that there continues to be a lot of work that goes on in the background with COVID-19. We know that this has been a super long pandemic, and we continue to be in the public health emergency stage, and that could be changing coming up in the not too distant future. But for now, we're still in that phase. We know that the numbers of our cases we see on occasion come down, they go back up. Right now, we've seen a little bit of a downward trend, which is a good sign. However, we also know that the COVID-19 disease transmission in our communities is still fairly high. And so where we're at right now, generally speaking, and Dale spoke to some of this, is that we're at a stage where it's really important that we continue to be vigilant in our efforts in terms of trying to prevent continued disease transmission with COVID-19. I know that we've heard that for a long time now, but again, we do know that the cases that we see, the case rate in the community stays high, but we're seeing this downward trend, which is really a good sign. We just want to make sure that we do not ignore the fact that it's still in our presence in our community. We want to make sure that we're doing what we can to hopefully prevent that from passing along from one individual to another unintentionally. So, the Indian Health Service and also working with the local 638 facilities or tribally managed health facilities have been working for quite a while on what we refer to as a test to treat initiative for COVID-19.
And, this is something that over time with the pandemic, it was a change because early on, as many listeners understand, we weren't fortunate enough to have the antivirals initially, along with other therapeutics to fight COVID-19 or the symptoms of COVID-19. And since we now have antivirals, since we have Paxlovid and other types of therapeutics, it has given us the opportunity that when we test folks at our health facilities, or if individuals test at home and they report to the facilities, we have that opportunity to provide treatment for those cases that providers feel that need to receive treatment. So I just wanted to mention that to the public to make sure that everyone understands that we do have those types of treatments, therapeutics available, and we continue to monitor those supplies for COVID-19, which is certainly important for our population. We continue, if for those of you who may have lost track with where we're at with vaccines, so we're at the ages of 6 months and older, and there are various decisions that healthcare providers need to make when providing those vaccines to the patients. So it's important that if you have not received either the primary dose, or if you have yet to receive your appropriate booster doses, then notifying your healthcare provider or at your respective healthcare facility is something that I definitely recommend. We know that we continue to monitor the vaccination rates here on Navajo Nation. Dell shared some of that information. And I just really love to point out, and I know it's been mentioned before, but I think it's so incredibly important to understand that here on the Navajo Nation, particularly the elder, which goes into the elderly population of 65 years and older, is over 91% completed with a primary series for COVID-19, and right at 75% to be up to date with all boosters as well. Those numbers are spectacular. I really like to see that. That means we're taking care of our elders locally, and that's just really, really great news. The other age groups are doing really well, but we always have the opportunity to continue to grow those numbers, grow those percentages, and make sure that we're doing what we can to fight that particular disease. We do anticipate that COVID will be around, and we will continue to see various variants of that. And again, it was mentioned earlier about BA4 and BA5. And we'll have to see, what is next with COVID-19. Dell mentioned a newer variant as well that is being sampled as well here on Navajo. So it's important that the bottom line is it's important that we continue to encourage our friends, our family, our neighbors, our loved ones to continue to seek vaccines for COVID-19. The importance of that has not gone away. It's still extremely important, and this will continue well into the future. So if you have that opportunity, or if you still have some decisions to make on that, certainly reach out to your healthcare provider if you have any questions about that, and they would be certainly willing to and willing and able to provide you updated information on that. So really, generally for COVID-19, the high level is, we see some trending downward in terms of our cases. The case severity is also down. However, we still do have individuals from time to time who demonstrate severe symptoms and have to be hospitalized. We also know that community transmission does continue at a fairly high rate. So we're seeing some good news on the horizon, but it's so critical where we're at right now that we continue to take those preventive measures. And when we talk about preventive measures, we like to keep it simple. And those prevention measures include, wearing your masks, continue to do that, particularly indoors. We know that we're going into the fall season, as President Nez indicated. We're starting to feel that kind of fall type morning, and we can sense that early in the mornings, and we see the weather changing. And so we know we'll be indoors more. And when we go indoors more, we know that we'll be exposed to one another more. So it becomes very important that we're wearing our mask, that we're getting tested when needed, that we can use home tests. We can also go to the health clinics and health centers to continue being tested. We continue to really encourage folks to hand wash as well. We never forget about that. But the most important at this time is those vaccinations, and whether it be the primary series or the booster vaccines. And President Nez had mentioned that there is a newer updated vaccine for COVID-19, which will include protection for the BA4 and BA5 variants. And that should be here during the week of September 7 through 9, in that time frame here on the Navajo Nation. And then that will begin being available. So we're excited about that. So the science continues to be followed in terms of that protection. Also, just generally wanted to move from COVID-19 to monkeypox. And I think, individuals as, similar to COVID-19, I just want to recommend to folks to make sure that you're getting your information from valid information sources. With COVID-19, we experienced a high amount of misinformation that started early on and has continued through COVID-19. And we just highly recommend to look for those sources that one would rely on, such as the Centers for Disease Control. Also, many of your universities, places like Johns Hopkins, and other universities that are well known for solid research, making sure that we're listening to the right voices and the right science that's being performed across the United States as well as internationally. But when we go into monkeypox, we know that it's a rare disease. It's something that we're not used to hearing about, of course, in the United States, at least those that are in the non-scientific world. But monkeypox has been around internationally over time. And generally speaking, in the United States, the threat of monkeypox still continues to remain low. However, it is here. We do know that. We do know it's in our surrounding states. And so it's important to understand a little bit about the disease, and that it's actually rarely fatal. And the time of onset of symptoms from monkeypox is usually from anywhere from 6 to 13 days after one has been exposed, but can actually range from, say, around 5 to 21 days or so. Symptoms for monkeypox include a rash that can be they can appear like pimples or blisters on the face. They can be in the mouth or on other body parts like the hands, feet, chest, genital area. And the rash will go through different stages before healing completely. This usually lasts around, say, 2 to 4 weeks. But it's important to understand that some people only experience a rash, while others may experience additional symptoms with things like fever, headache, muscle aches, back aches, swollen lymph nodes, chills, exhaustion, those kind of things. So it's important also to know that really the current outbreak that we've seen in the United States is generally reported among those who have had close, sustained physical contact with other people who have monkeypox. So, this is something that's normally been documented with monkeypox. It really intimate contact with an infected individual. So the good news is that there is vaccines that are effective against this particular virus. And in fact, over time, we've heard of the Jynneos vaccine. And the good news is for this is, as we're set this week to receive some supplies of that, You know, the Navajo Nation has been outstanding in terms of advocating at the national level. And our healthcare facilities and working with Dr. Jim and others have been able to make some orders for that vaccine, which will be here, is set to arrive this week. So I think it's really an important measure. We know how important vaccines were when they arrived for COVID-19. Although we don't have, cases per se here on the Navajo Nation, we know that we'll have that protective measure of having the Jynneos vaccine here on site, which is very, very important for us. So looking forward to having that. And then that will be utilized to, the providers, local providers with all the healthcare, the tribal healthcare organizations, the Indian Health Service health facilities. The providers will be the ones who work with patients and determine who might be at most need of those early vaccinations or vaccines if needed. So just wanted to mention that we continue to work with our partners, certainly the Navajo Nation. We work with Johns Hopkins, and we've just really appreciated the work with all the 638 facilities, with Navajo Nation leadership and government. It's been outstanding for COVID-19, and we'll continue to work hand in hand on many of these issues. With that being said, I'm going to stop there. And I believe the next in line was Dr. Laura Hammett with Johns Hopkins. And Doctor, I'll turn it to you at this point in time. Thank you.
Thank you, Captain Johnson, and thank you, Mr. President, for the opportunity to join the meeting today. I appreciate the comments from the Epicenter with Del Yazzie and Captain Johnson's comments as well. And I just want to underscore a lot of those messages that have already been shared with everybody today about the importance of vaccines for COVID prevention, as well as the importance of continuing to mask to help slow the transmission of the virus. I was going to share a couple of slides with the group, and I'll do that now. Let me just find the correct application. Okay, let me see here. That looks like the wrong screen, but let me see if I can. And apologies for that delay. I will. Does everybody see that slide okay for this update? I mostly wanted to emphasize the importance and availability of COVID-19 vaccines. Vaccines are recommended for everyone 6 months and older, and everyone 5 years and older is eligible for a booster dose of vaccines. So important to go into the facility and keep that protection high. We actually have data from the Navajo Nation. This is data from a study that was approved by the Navajo Nation Human Research Review Board to look at vaccine effectiveness here on the Navajo Nation. And that data show that the vaccines are highly efficacious in preventing and protecting against COVID-19 hospitalization, around 94% efficacious against preventing hospitalization. But that protection declines over time, and you can see that in the graph on the right-hand side. The further out that you get from having been fully vaccinated with the primary series, the protection starts to decline, which really underscores the point that boosters are very important to maintain protection. The vaccines are also really important to help prevent long COVID. We know that even people who've been infected with a mild course of COVID illness can develop symptoms of long COVID, and I think you're seeing some of those symptoms here. It can affect lots of places in the body with tiredness, can contribute to brain fog. Some people have persistent changes in smell or taste, persistent cough or difficulty breathing, or heart symptoms. There can also be effects from COVID-19 infection on the female and male reproductive systems. And we know that the best ways to prevent long COVID are preventing COVID infection to begin with, so being fully vaccinated. But we also know that COVID vaccination can reduce not only the chances of infection, but if you do get infected, can reduce the chances of developing long COVID. As Captain Johnson mentioned, we've really been emphasizing the importance of testing early in order to access effective available treatments. Some people may test early in the course of symptoms and may test negative, and in that case, it's important to repeat that testing a couple of times if COVID-19 is suspected. Tests are widely available, and those results should be reported in to IHS or your local tribal health facility so you can ask about and access treatment. The treatment must be started within 5 days of symptom onset, so that makes it really important to do that testing early, and again, to repeat the testing if there is any if there are symptoms, but the test is initially negative. Captain Johnson also mentioned that we'll have new updated COVID-19 vaccines coming out this fall that will provide enhanced protection against the Omicron variant, and those should be available very soon. But if you're not yet up to date on vaccines, those will be available for booster doses for people who are up to date on their current vaccines. So really important to get that primary series in, and then can also get boosted with the Omicron containing vaccines that will provide enhanced protection. A number of the speakers have mentioned Monkey Pox today, and I just wanted to share briefly. As has been mentioned, there has not been a confirmed case on the Navajo Nation, but it's important to have knowledge about this so that we're not afraid of it and we know what we can do to protect ourselves and our families. This is not a new virus, unlike COVID. This is a virus that we've known about for a long time. And it's also different from COVID in that it's spread in a very different way, most commonly from direct contact with an infected person. The symptoms, as Captain Johnson mentioned, is most commonly a rash, but this isn't always present. You can also have symptoms such as fever, tiredness, aches or chills, swollen lymph nodes. So, and this is a rash that typically appears anywhere on the body. It can last 2 to 4 weeks. And the virus is spread by contact with that rash. So other ways that the virus can spread, this is really, like I said, very different than the ways that COVID-19 is spread, and is really spread through very close personal contact, which can include intimate contact, sharing bedding with somebody, or towels or clothing with somebody who's infected and has the rash lesions. The close skin-to-skin contact with somebody who has that rash, very prolonged FaceTime. So this is not like COVID-19 where we think about, having close contact for 15 minutes or so. We're talking about, close contact for a prolonged period of time. That could be responsible for spreading the virus. So knowing how that virus is spread and transmitted, there are important steps that we can take to protect ourselves, which include avoiding close skin-to-skin contact with somebody who has a monkeypox rash, hand washing often, which is something that we know is good to prevent many types of infectious diseases, and avoiding crowded events with very close, prolonged, personal skin-to-skin contact. As Captain Johnson mentioned, vaccines are coming to the Navajo Nation, and they are recommended for people who have been exposed. So these are people who have been identified as a close contact, or somebody whose sexual partner in the past 2 weeks was diagnosed with monkeypox, or somebody with multiple sexual partners in the past 2 weeks in an area with known monkeypox. So just a reminder that we know how to prevent these infections, and that we have the tools that we need. So informing ourselves with the knowledge and these tools will help to keep everybody safe. And with that, I will pass it back off to the team. Thank you. And I will stop sharing. Thank you.
ato ye ko ta ata hosia hakone